back there. And y'all will come, and then if a group of you all would come this through, please. Okay, yeah, that's right. Everybody shift over. Mel, you stay in the same spot, please. And yes, if you'll go over. Yes, please. Yeah, yes, you right there. It's easier
I can
for
move
all.
Yeah. Do you want me to move over?
Actually, if you would, yes, and then you're in the back.
Yes, sir.
No, you're good.
So you don't. You're the best in the house, right?
All right, we're gonna make this work then. Everybody ready? Call the sheriff. Okay.
Sorry, I think we need one more person.
Well, come on.
Is there anyone else in the hall?
See the car there?
Where do you like me over here?
This is perfect. Come on.
I think on the other side.
Hello, everyone. Thank you for being with us today. You know, I do a lot of press conferences from behind this podium, but this is the first time in the history of the Sheriff's Office that we've ever had an event such as this. Now, I want you to think about this for a minute. This is a historic occasion where all of these mental health providers have come together to make a positive difference. And I want to give you some history of how we all came together. As a law enforcement officer and certainly as a sheriff, one of the most meaningful things that ever happened to me was to be appointed to the Marjorie Stoneman Douglas Commission to investigate the horrible, horrible murder of those beautiful children at school. And we sat through not only hours, but hundreds of hours of testimony, and there was a common denominator and theme that I received from this. And the theme was that there were silos in our system. There were silos that had never been broken, were not going to be broken as long as we continued to think the way that we thought, because that's the way we were all raised. What we found with that horrible shooter, and I won't use his name, is he received an incredible amount of mental health services throughout his life. But this group didn't talk to this group, and this group of providers didn't talk to this group of providers, and this group of providers certainly didn't talk to the school system, and the school system and the providers certainly didn't talk to law enforcement. Now, there were many other failures, but the common denominator for me is if we're going to be successful, we can't continue to do the same old thing and expect different results. When we made that suggestion among different providers here, the exciting part was not one provider pushed back. We all understand we come from a different perspective, but our goal is all the same. We have 16 organizations represented from the county. And during this process, I appointed the first ever Director of Mental Health Services for the Sheriff's Office to be my coordinator, Gwinnell Brandt. So we're here today to announce the next phase of collaboration that's enhancing the mental health programming in Polk County. We can't wait on the White House in Washington, D.C. or the State House in Tallahassee to make a positive difference. We're taking the resources we have locally, and our goal is to set the model and the mold and the trend for not only this community, this county, but for the state and the nation. And it all starts with working together. And we have overcome monumental hurdles by working together. My personal interest in this, from the Sheriff's Office perspective, is I run the biggest mental health facility in the county, and that should not be. Folks that are significantly mentally ill, people that have addiction problems, significant addiction problems, need to be in a facility or under services that helps them. If we do that, we'll reduce crime, we'll reduce victimization, and we'll give people the opportunity to not only stay out of jail, but to become physically more healthy as well as mentally more healthy, and they can carry on a productive life that's in the best interests of all of us. We know, according to Bureau of Justice statistics, 63% of the jail inmates have a substance abuse disorder. 44% have a mental health disorder. In Polk County, 32% of our jail inmates are on psychotropic meds. Yet many are still undiagnosed. The Sheriff's Office worked 401 overdose deaths in the community since 2019. That's staggering, and it's unacceptable because that's someone's child, mother, father, brother, sister, relatives. There have been barriers, and the barriers that we frequently hear about are transportation, program waiting list, legal identification. None of those barriers exist in the county jail. None of them. So we have a significant population that we can do more to help, and we are. And it's the brilliant people that are here today that deserve all of the credit. There are no barriers in jail, and if we do what we can do for those that are in jail, I like to think of them as a captive audience. Then we can move forward from that and also provide services for them in the community. We call this the STAR program, Substance Treatment, Advocacy, Recovery, and Reentry. Two very strong forces have now combined after a vision by Joy Johnson, our Director of Health and Human Services for the county. Helping Hands, and also our Tri-County CEO, Bob Reinhardt. But I want to take you back. Dr. McMicken, who was my personal physician for many years, he's since passed away, called me one afternoon and he says, Grady, we've been talking about a program. Mary Beth Moore and I have talked, and the team has talked, and we think we can do more with mental health services in the jail. And I said, Dr. McMicken, I could only dream about that. That's what we've always wanted. And that's where Helping Hands started. So Dr. McMicken has passed now, but he'll forever be one of my heroes, because even though he's not with us any longer, he is still doctoring people because of his wisdom. So Helping Hands not only has Polk Health and Human Services and the Sheriff's Office, but Polk County Fire Rescue, Yes Care, Tri-County, Winter Haven Hospital, Lakeland Regional, Peace River, Core Behavioral Health, Florida Department of Corrections, Probation and Parole, and County Probation, and now JAZA, our in-jail substance abuse treatment program. I've got some other notes, but first I would like to introduce to you our chairman, Commissioner Braswell. Commissioner Braswell is a leader. One of the biggest challenges to any program is funding. And our Board of County Commissioners said, yes, we'll help. Yes, we'll make a difference. And at the end of this program, I'm going to vision for what one of our next steps will be. And it was because of our chairman and our county commissioner, Braswell, leading the charge and our other commissioners supporting so that we can make a positive difference in our community. Chairman?
Thank you, Sheriff. I've got a statement I want to read, but before I do that, the one thing the Sheriff said, in the 7 years I've been in government, the one thing I've noticed are silos. There's so much information that doesn't get moved back and forth. Just the idea of moving forward and knocking those down, better communication, I think will help everybody in this situation. But I do have this. The vision of Dr. Thomas McMicken of providing services to incarcerated individuals who needed additional support for behavioral health or an addiction was realized in the creation of Helping Hands. Since its inception in 2018, the program is focused on its core tenets: healthcare, access, navigation, delivery, and support. Helping Hands, a nationally recognized program, serves as an umbrella framework for many programs that support both incarcerated individuals and those re-entering society post-incarceration for up to 12 months. The programs include Hatch, STAR, and Second Chance medication-assisted treatment. These expanded programs combine to support these vulnerable residents in their transition from incarceration to active and contributing members of our society. A multidisciplinary team approach brings partners together in an innovative way to identify participants and assist them in connecting with behavioral health providers, resources for recovery support, medications, case management, health assessments, transportation, and housing. This team is made up of community paramedics, certified peer specialists, case managers, housing specialists, to name a few. Overall, this program has seen many successes that have changed the trajectory of those individuals recycling through the criminal justice system. It not only impacts the individuals, but it also positively affects their families, their neighbors, and our community. Thank you.
Thank you, Mr. Chairman. And next, I'm going to invite Tri-County CEO Bob Ryan to speak. Bob and I go back many, many years with the JAZA program and the work that we've done. And once again, you can't measure the absence of an event. So when you look at all the people that all of these folks represent that we've helped in the community, what you don't see is the ones that they've helped that have stayed out of trouble, that have put their life back together, or that never got into trouble because they were there. These are the masterful people, and this is one more example. Bob, come up and speak with us.
Thank you. Hi, I'm Bob Ryan with a giant heart. Thank you very much, Mr. Sheriff, inviting me to share. Early in my career here in Polk County, I saw that there was very little being done. But when this sheriff was elected, slowly but surely, the events to bring us to this day have occurred. The JAZA program is over 30 years old. Evaluations in the jail and it is another piece that was going on during the sheriff's tenure. And as we continued on, the services that we delivered started to prove itself in non-recidivism to the jail. So with that captured, the JAZA program was instrumental in educating individuals here in the jail, or at each jail now. And that meant that individuals were no longer recidivating in the manner that we have seen in the past. Consequently, Tri-County continues to be a full supporter of the programs that are being shared here today and that have continued from the past to today. We are really happy to be partners with Peace River and the crisis response team that is in every sheriff's office. For that is the prevention piece relative to people coming into the jail. And if they get past that point, then they come to the jail and we work with the folks in the jail from a mental health perspective now as well as the substance use. Then the path continues through a program called Helping Hands. And Helping Hands has been an extremely successful program in helping individuals move through services in the community that are waiting for them to be obtained. So I thank the Sheriff's Office, Mr. Sheriff, the county, for having made this possible. And you too, Joy, wherever you stand here. I know you're here. So thank you very much, and that's about all I have to say. Thank you.
I want to list to make sure we do the supplemental or additional stakeholders that have agreed to provide services and have agreed to help us. And once again, if you're from the outside looking in and you see these folks here, you go, well, there's a lot of nice folks standing up there. But you you can't understand the energy that I have, and that's why I repeat it, that this is the first time that we've all been in the boat with an oar in our hand, rowing in the same direction. Heart for Winter Haven, Heartland for Children and Neighbor to Family, NAMI, Peer Specialist Training, to name a few. Now I'd like to introduce you to Denise Harrison, who has worked with Tri-County for 18 years, and she's currently a community program coordinator working in the STAR program. She just happens to be a peer specialist. She is the subject matter expert. And from what I understand and my interaction, an absolutely great one at that, who has worked in our jails for years and years and years. I'd like for you, if you will, to share your story and the vital role of peer specialists in your recovery efforts. Denise?
Hi, guys. Denise Harrison with Tri-County. We're in such a different time than used to. Used to, if you had a mental health condition or a substance abuse disorder, it was a dirty little secret that nobody talked about. Now I'm asking people to put it on their resumes. So we've come a long way with that. But the biggest part about the peer specialist role, we talk their language. We ran the same streets. We've been to the same jailhouse. We've been to hell. We know the way out. And from the beginning conversation with these individuals, what we're asking them is, what is your idea of success? What do you want to accomplish? What do you want to do? And then from there, we develop a plan and we hold them accountable. So how we're able to go across agency lines with releases of information, of course, is we follow them to their doctor's appointments. If they're having a problem communicating with their doctors, we help with that. We take them to 12-step meetings. We take them to the grocery store if they're not capable of doing that on their own, until we get their strength built up and their belief in themselves built up to where they can handle it on their own. One of the great things about Tri-County is we never have a wrong door policy. If you're a client of mine, you're a client of mine forever. And if you ever need us, we're here for you. And with that need, Jersey Commons is a subsidized housing unit being built by Tri-County in Winter Haven. That was going to help our high-need, high-utilizers, say those people who can't just get a grip. You know, the mental health is too strong. Social Security doesn't pay enough to sustain rents in the area. So what do these people do? And what we do is we get them over to a subsidized housing to where they can receive the case management services, peer support, and basic health care. So I'm excited to be with this. I love working with the Sheriff's Office. They have been more than accommodating with anything that we've tried to introduce the inmates to. I have not been told absolutely no on anything, and I do ask a lot of favors. But whatever they can do to assist, they're with it. And that is huge. And working with Cove and Sheriff's Office and the community paramedics, I mean, this is a dream come true. And our numbers don't lie. When you see what that additional support can add to these folks, they can do amazing things. They just need a little extra support. Thanks.
Thank you very much. As you can see, we have the right people and the right organizations rowing together. And this is just the beginning. I'd like to mention Polk Vision that did a research project. And Polk Vision focused on what the community needed as far as mental health services. And this is all about wraparound services. This is all about 360. I can remember back in the day when they said, hey, we need crisis intervention training for at least a deputy or a police officer on each shift. As I looked into the project, I said, no, we need everyone trained. In the beginning, I actually had one of the mental health teams that was eager to help us come back and say, Sheriff, that's overkill. We only need one or two a shift. And I said, no, we need everybody trained. Today, every deputy, every detention deputy, everyone who works in our communications center is certified in CIT, and it's made a positive difference. Now let's fast forward. Just recently, they came out and said, hey, we need everyone trained, and we were ahead of that. We asked the police chiefs to join us several years ago so that all of their officers could be trained. And they said, sure. So the training we provide now is not just for the sheriff's office, but our police officers as well. It's our vision. It's our vision in Polk. We are currently working on another project, on a pilot project that's going to offer alternatives to mental health sentencing for individuals with serious mental health issues. We know that when people commit crime and they receive probation, or they commit crime and they're sent to jail, if they don't have the resources and the help, then they can't get better. I've talked with the state attorney, the public defender, the chief judge, and we're working on a project now, in addition to all the work in the community that these folks do independent of the jail. We're working on a program now that we're going to roll out this spring, whereby when people find themselves in trouble, that they're given the opportunity to have a probation, and will provide the medication and the counseling for them so that they don't commit crime, they don't come back into the system, and they are able to provide for their family. That's something they have to volunteer to do. But at the end of the day, we can't wait around for someone else to solve the problem. That's why we're all here today. So on behalf of the men and women of the Sheriff's Office, I thank all of our community providers. You mean so much to us. I wish God's greatest blessing on each of you as you do God's work. And we look out for those that without help, without medicine, without mental health counseling, they just can't stay out of trouble, or they just can't flourish on their own without support. Now, what we don't see, once again, are the ones that they've already helped. But we have a group of people that come into the jail every day, and our goal is to break that chain of conduct through helping their mental health issues. Thank you very much. Have a good afternoon, okay?
Explain how mental health help at the jail looked last year compared to the way it's going to look going forward.
Well, we have had an increase in helping those with mental health issues over time. But historically, none of us have ever had the system in place that we want. And we had different groups that would come in, from volunteer groups to our JAZA program that the county paid for, to Helping Hands that we put in place several years ago. Well, now JAZA and Helping Hands are going to join hands, and we are coordinating, as I guess the best way. We're coordinating our efforts. We're breaking down the silos, and we're saying, hey, we've got to all work together if we're going to make a positive difference in our community. Our crime's at a 51-year low, and we could just be satisfied with that because it is a remarkably low crime rate, but we're not satisfied. We want to improve the health, the physical health, the mental health of those that are in our community and our society. We are seeing a need, and we're all together filling that need. But once again, if it weren't for our Board of County Commissioners that are stepping up for us, as well as all of our providers that are going above and beyond, we're outside of our comfort zone. We're visioning a new normal so that we can do our very best to, one, cause our population in the jail to go down, two, make our community even safer, three, help those that struggle with mental health issues and drug addiction issues and cannot overcome that by themselves. We think it's a win-win for everybody.
Are you adding more counselors at the jail?
You see what we have here today? I believe we have, okay? Thank y'all very much.
We have a number of partners here, and if anyone wants any individual interviews, you're welcome to do that. I think I had a couple of questions. Also, I don't know if we have any Spanish speakers in our room now, but